everyone. So I'm presenting a case here, similar like the previous one, and of orbital epic syndrome and total ophthalmoplegia. So orbital epic syndrome is an uncommon disorder involving multiple cranial nerves, including the optic nerve. Patient presents with total ophthalmoplegia and visual dysfunction. The etiologies can be, as Sir said, inflammatory, infectious, neoplastic, traumatic, iatrogenic, vascular, etc. So my case was a 60 years old female, and she presented to us with a right eye total ophthalmoplegia. So she has a history of right upper jaw pain 4 months ago, and it was followed by 4 teeth extraction, that is the incisor, canine, and 2 premolars in the right upper jaw. It was followed by fever for 4 weeks, and it was managed conservatively. The ESR at that time was raised, and but other markers were normal. The typhoid and malaria, the fever panel was within normal limits, and she is a known case of hypertension with poor compliance to treatment. On ocular examination, the patient had complete ptosis, uh, loss of forehead wrinkles. We can see all the signs of facial palsy, and we can see in the 9 gaze picture that there is right eye total ophthalmoplegia, and the pupil was dilated and fixed. The vision was finger counting at 1 meter, and the lens had cataractus changes. The left eye was unremarkable. So here I wanted to examine the oral findings of the patient, because she had a history of fever and she had a history of pain in the jaw. So I found that the local site was completely healthy, and X-ray, she had the X-ray with her in records. So it did not show any local signs of infection. So here a suspicion was a skull-based infection that has penetrated deeper, or a neoplasia. She had consulted multiple practitioners before, and their suspicion was also the same. So we went for an endoscopy here, and the nasal endoscopy, and we found a globular round mass in the sphenoid sinus. We can see here, and we took a biopsy from it. So, and after finding a mass, we ordered a CT PNS, and we found a mass here involving the orbital apex, that is extending into the right orbital apex and completely destroying the skull base and more towards the right side. And on biopsy, we found moderately differentiated squamous cell carcinoma. So, of all cancers, head and neck cancers comprise 26% in males and 8% females in India. So, orbital apex syndrome is itself a rare disorder, but only a few cases reported in association with head and neck cancers. So, unilateral orbital apex syndrome is secondary to skull base neoplasia, and the presentation here suggests that the tumor is locally aggressive. So, my take home message is that the history can be misleading. So, initially we were thinking in terms of infection, which was not there, and total ophthalmoplegia can be an ominous entity, so we need to have a high degree of suspicion. Thank you.
Title was
I think
Your-
Charul Mittal.
Charul
Skull-based
Mittal. Okay,
osteomyelitis
okay,
and
okay.
ophthalmoplegia.
Ma'am,
So-
the title here is wrong. I submitted
Yeah.
a different title. I mailed, but it wasn't correct.
Okay, okay, okay. So you have referred the patient to ENT department. They have done the biopsy,
Yes,
and then
ma'am.
you got the reports.
Yes.
Right. Okay. So what was the main suspicion while doing the clinical examination? It was the history.
Yes, ma'am. The history was totally going towards the infective cause.
Mm-hmm.
She had fever, she had right jaw pain, and she had history of teeth extractions. So initially we were also thinking about in terms of infection, and the places where she had consulted previously, they also were thinking about in terms of infection. So we investigated further
Okay. So imaging has been done after that.
after
only.
the biopsy, ma'am. When we found the globular mass, we got an
So what were
imaging.
the DDs while seeing the globular mass?
Ma'am, in globular mass, first there is it was there in the sphenoid sinus. So skull and squamous cell carcinoma is the most common cancer of the skull base. So it like we were suspecting suspecting that, and we found that.
So, Charul, again, the sequence of the investigation is slightly confusing because if a patient presents with ophthalmoplegia, did she also have any sinus-related symptoms? You didn't
She
mention.
had a blocked nose, ma'am.
So, I mean, does that warrant a biopsy first or an imaging first? A total ophthalmoplegia with the facial palsy, you are suspecting here. Of course, there's something going at the orbital apex or even beyond it because of the facial nerve involvement, right? So I would suspect something closer to the, the CP angle and other places, or even the ear somewhere, because both the things are involved. And that's a very, huge lesion because it's involving ophthalmoplegia also, which is total, and the pupils were also involved.
Yes, ma'am.
Pupils were also involved,
Yes,
and plus there is a seventh nerve which is there.
Yes,
Okay,
ma'am.
so they are quite separated,
Yes,
not
ma'am.
from the orbital
Yes,
apex
ma'am.
also. So big lesion. So I would first go with an imaging rather than going for an
Ma'am,
endoscopy.
actually here the attendant with the patient, his son-in-law was there, and he said that the patient underwent imaging, but they did not have any records. But they were told that there is some growth in the brain. So then we wanted to go for endoscopy first.
So all the more important to check the imaging first because any growth, I mean, you just don't jump into doing a
Okay.
biopsy because there could be something which is contraindication for a biopsy or something like that. Okay. So
Okay.
and you should be prepared for it. Like you want to go for a biopsy, you want to go for a culture, or sending for microbiology or histopathology guided by your own imaging. So I would go for an imaging first or try to look at the films first and then refer appropriately.
Okay.
Okay.
As you were giving history also, no, that they were telling there was some mass. So definitely, as Dr. Shailja said, first non-invasive should be there, then you go for the further invasive as per the reports, as per the localization. You cannot go like blindly for the